Welcome, Manish. Welcome to
Hi.
the Hi. Welcome to the Busy Conversations. This I am a host, Naveen-Madishetty, and this particular conversation is with the entrepreneurs and leaders in the area of sustainability. Today, I am pleased to invite Manish-Ranjan. He's the founder and CEO of NanoHealth, and he is into healthcare, and he's one of the future business leaders. And thank you, Manish, for accepting the invitation.
Thank you, Naveen, for inviting. I've been seeing your work, passionate work in sustainability and environment for so long, and really proud to be here.
Great. So, few words I would like to introduce to the all the guests who join live on the YouTube. So, you are also the recipient of Hult Prize, a prestigious prize in the year of 2014, and you are the only startup which has been selected. I think it's a global competition happened at that time, and you received the award in the form of support for the other seed startup and from the Bill Clinton, and that's in US. And you are an alumni of ISB and IIT Mumbai, and therefore it would be a very interesting conversation also for budding entrepreneurs and startups how your journey has been. So I would request you to to start the first thing first. So the how has been in the last 1.5 year for you the journey as an entrepreneur, as an individual?
Yeah, well, the journey had begun around 6, 7 years back. I come though I'm an engineer by education. My dad is a doctor, so I have always been very, closely connected with healthcare. There was the whole idea of healthcare and basically, engineering. What I saw day to day, and what I was seeing for large corporations, where I used to improve business process and making them entire organization more and more efficient. So I had a lot of perspective on how the thing should work in tandem, right? And when I would see healthcare from such a close quarter, I could see that how far it was from what I could see in many other industries. So, so that one of the goal was to make the whole healthcare a lot more connected, a lot more efficient, and of course, so there were many challenges. But when COVID hit, almost everyone, directly or indirectly, then that is when I could actually see the whole power of the connected care that we envision to actually provide. And that also allowed others in the entire ecosystem, both the patients, the doctors, and other stakeholders, to really appreciate the value of digitization, the value of connected care, teleconsultation, data, and so on. So we were basically very proud to actually quickly tweak, I would say, our solution for COVID purposes. We did a lot of work during COVID times, and it was very heartening personally that everything that we envisioned has actually literally saving lives. When we started, the idea was to work primarily on long-term diseases like diabetes, hypertension, and when COVID hit, what would typically happen in 14 years in, let's say, diabetes, hypertension, was actually happening in 14 days. And but that's the power of platform or systems, configurable platform and systems. We could quickly tweak, make years into days, and days into hours, and the impact was as expected. So we could, so it was very, very heartening personally. Proud of what myself and my team could do and create really a solution that has actually literally saved thousands of lives. And yeah, I think, of course, we don't expect any of it to, like, happen ever again. but definitely gives us a lot of confidence that we are absolutely ready to take care not only the current challenges that we know, but even envisioned. I mean, like the challenges that we haven't envisioned so far. So yeah, thanks for asking that question.
I think it must be a sense of satisfaction, also an excitement must be for you, having dealt with one of the challenges of our greatest challenge. To that again, what do you think that about the medicine systems that are in place around the world? Do you think they are sufficient enough to deal with both in terms of conventional medicine and also the kind of infrastructure that is available? What do you think in general? Of course, you can't meet the entire population, but your sense of the medicinal systems that are there in terms of conventional medicine systems and also the medicines and the infrastructure and the hospital systems that is required. Do you think the entire healthcare system was geared, and how do you see that? And could you also draw something a light on about the traditional systems, how it was? Have you heard of these support systems were doing well in the country like in India? So what was your thoughts?
Right. So, I mean, the number of deaths around the world, definitely, I mean, we could very easily deduce that the world was just not ready for it, right? So there was, I mean, yeah, I don't think there's any doubt about the fact that, we as a human generation, we're not ready for a pandemic of this size. But I think there has been enough warnings by people that it can come. What should be done to avoid it or reduce the impact, and what should be done? And I think most of it was completely not heeded to. And I mean, and that's one of the challenges that we are reeling under. I mean, so many people have actually lost their lives and near and dear ones. So yeah, but I think and the challenges remain. I mean, not only in the country like India, but around the world as well. I mean, the challenges are, I would say, not very different. A good example is let's say US. The number of critical care devices over there were many more times than, let's say, in a country like India. But still, the number of deaths per capita is higher, right? So it's not only about the devices. It's not only about the doctors. It's not only about the nurses. It's all about how these various stakeholders work in tandem with each other to make sure that the right care is provided to the right patient at the right time, right? For example, let's say the experience that, I mean, I really believe that most of the best care, the science of healthcare have increased, enough that once you reach the doctor at the right time, the best of the care can be provided, right? I mean, we are slowly conquering cancer and many other diseases, right? But the biggest challenge is in identifying what is the right time, who is the right patient, which is the right care setting, and which is the right doctor, and losses because of that is all around. I mean, a very simple, even if you see COVID, right? If you have, let's say, a great, home monitoring program, I mean, most of the very few people were actually even needed to take it to the hospital, right? But that was completely missing. I mean, the people who could have been treated pretty well at home, I mean, they were in hospital many a times, and the people who could not, who should have been in the hospital a lot earlier, I mean, they were like left, waiting for hospitalization. So I think a lot of gaps has been identified. I mean, like was like shown very bluntly in during COVID times. But the real challenge is how do we address that? And the biggest problem if you see that how much of that has actually been challenged, actually been addressed even today. The biggest problem which I found was that everyone was doing their job, right? The doctors, the nurses. I think thanks to them and kudos to them and their families that they did what they did, right? But if you see that even today, the biggest challenge is that how each one of these stakeholders actually work with each other, right? And that is where the gap continues to remain, and that's where the hospitals and health systems, like you were saying, the leaders over there needs to work proactively to make sure that these various pieces can work together. For example, healthcare is challenging. Each diseases have their own care pathways. There are so many diseases. Each one of them have their own care pathways. Each one of them have their own apps to manage it, right? And then for each of these apps or technology, there has to be a separate way of monitoring or training that needs to be provided. And that's why it has been, the adoption has been of technology, let's say in country like India, has been a huge challenge. And that's and that's definitely not scalable. And that is where we need to have a common comprehensive solution which can be tweaked for multiple diseases and not only for one. So I think there were challenges. People could see it, observe it, and definitely the need for technology has been made very clear that these are the reasons why technology is required. Of course, there will be short-term challenges and with adoption and other things, but I think everyone in the healthcare system and the patients have started accepting the importance and need of technology, teleconsultation, and so on. So I think interesting times ahead, but for sure, something like COVID has been able to bring the care in the healthcare a much more bigger than what was only sick care before. So yeah.
Yes, of course, the awareness and the the interest in the healthcare has been on the rise, as you said. And do you think this awareness can be sustainable, or do you think are people enough active now, and they would like to take care of a preventive healthcare or other kind of
Yeah, things have definitely improved. Things have definitely improved from what it was, but I don't think that it's actually very difficult to actually go after preventive health for each and every individual. Okay, while we have been working in preventive health forever, but it's actually we completely appreciate that why it's so difficult. If I have no pain, if I have no reason to go and visit a doctor or a specialist, or to go to a lab for care, there is no reason why I should do that. Or for that matter, taking a simple vitamin D medication, there is no reason to do that. But having said that, the reality is that like vitamin D deficiency is reached the pandemic says 90% of the people are vitamin D deficient, and if it continues like this for long, it directly affects, among other things, the immunity, and that's directly affects, let's say, the COVID directly takes advantage of that, right? So a very basic things like this. Has become come to this proportion, and that's we have to be able to address it, but a lot of convincing, a lot of still a lot of convincing with the data and information is required for the people to actually go ahead and make the change, let's say in their habits, or to start taking supplement pills. And these are I'm telling you very simple examples, and forget about diabetes and many other things which are like a lot more I would say have a lot adverse effects. So yes, definitely, I would say 10 times better than what it was before COVID, but still a long way to go. But what we have also seen and learned from the experience of COVID is that you can't leave everything to the individuals. In the sense, what I'm trying to say is that if we're to just leave, for vaccine, if vaccine hesitancy was so high in the beginning, right? And if you could just leave and not put enough energy behind it, I'm sure we would not be in a situation with the reducing number of cases where we are today. And that's where convenience and awareness are very crucial to ensure that the whole idea and concept of preventive health remains sustainable in our society. So I still a long way to go, but definitely we're taking the right steps in the right direction.
So how your experience has been working with hospitals, government, and also of course the large scale patients you must be having, because the scale at which you have to deal with the patients is definitely higher, and the kind of situation you deal with, mostly it is like an emergency or war situation, and you are very active during the this entire period. So have you seen any sea change in the way governments and other important stakeholders like hospitals and diagnostics and other players, the way they have worked, and do you think that continuity is still there?
Yeah, I mean, no, so I mean, like two things. One is yes, I mean, definitely every hospital, every stakeholder did put in tremendous number of hours and hours to make sure that they can address the demand or the need that was there in the market at that point of time. But please know that please remember that COVID has also taught us that most of the people are in are at home, not inside, right? And that's if you were to ask me, and yeah, I think everyone who could get to the hospital, I have no doubt that they were given the best treatment over there. But this differentiation between who needs to be in the hospital and who needs to be in the who can be managed at home, that was a big gap there. And even though almost every hospital was trying to provide home care services, I mean, be it the way data were collected, be it the inference they could make, I mean, be or the technology that was being used. I think from whatever I saw, I think there was a big gap over there. And that's where we did see that a lot of people who were working with some of the best hospitals in the market, they reached out to us, and just because of let's say our digital prowess or the transparency that we maintain, be it the care and the direction of the care, they worked very closely with us. So I think I mean, I just want to reiterate the point that the care, the critical care is the hospitals are meant to provide the critical care, and and they are doing a great job at it. I think the quality of service, the quality of hospitals have improved significantly. But the moment you leave the boundaries of the hospital, that's as I mean important, and that's where there's a huge gap over there. And I mean, sooner, and the organizations that are able to cover that gap are going to make the biggest difference. And I think there's a lot of I mean, work is still required, and and the kind of preventive health work that we do, which extended for this. I mean, the best I would say feeling for me and my team was when one of the doctor who was working with us said that we get more information about the patient through a platform than we get, even when we are standing in front of the patient in the hospital. Right. So that was like because we captured every day, multiple times, the readings. We could show the number of days it was for each and every patient, and the decision making for the doctors were very, very easy. Because for a doctor, you need to get data from so many different perspectives, so many different ideas, and if you are able to kind of combine it in a way that they're looking for and present it, I think that makes all the difference between the life and death of the patient. And during COVID times, we could do that. And same we are doing for many other diseases now. And the goal is to provide data to the doctors in a way that it becomes diagnosis becomes a lot easier for them, and the right care can be provided in one go. Because before it's late. So yeah, interesting times, a lot to learn. We knew, I mean, gave us a renewed energy that, we are on the right path and we need to just keep growing the way we are growing right now. Yeah.
I would like you to actually to, give your thoughts on, because you have heard of a lot of alternative medicines during this time. And you have seen the conventional medicine over the last 150 or 200 years, which is called modern medicine from the advent of science and technology. So there are many traditional medicines, around the world, including in India. We have heard of in many countries. So Ayurveda and herbal medicine, there's a lot, as a talk and also is in use during the pandemic time. What is the contribution and what is the you think importance of this knowledge, and this is available? And do you think this is geared to take up in a formal way? Do you think it can meet the capacity building also, if it were to meet the requirements of the many people? How do you see this in practical terms also?
Right. Yeah, I think, like all these different sciences, ways of medicine they're here to stay at. And I think each one of them have their own role to play in our society. But the way I look at it is that, depending on at what level of care you are, right? Number one, I think a lot more data needs to come with each of these sciences. Okay, I think we have a very structured methodology for identifying, which drug in, let's say, in modern medicine works, which doesn't work, and there are now at this point of time, there are bodies which ensure that whether, they're okay or not okay. Like we've all been waiting for covaxin to, get approved by WHO, and it took forever for them to do it. And most of the times it was for the data which they're asking for. But if I say that I know that there is a lot more the information and data is being captured for the alternative medicine as well, but is it as rigorous as we have for the modern medicine? Maybe not, right at this point of time. So until it reaches that level of rigor in providing the care, I don't think that adoption will be so much, right, and from the people, from the doctors, and so on. So yeah, I think I really believe that all these various kinds of types of medicine science are going to be around for us in our society, but the quality or of rigor should not be reduced for any kind of in these medicine. In the short term, I think modern medicine is definitely way ahead, and it'll be. But I'm sure that Ayurveda and other sciences will catch up and show the real impact that they can do for our society.
No, it's great to hear your thoughts, which are very much in line with all the medicinal systems. It is very important because this particular conversation I would like to have in the light of looking at in a very neutral way, and also while we know that the conventional medicine, of course, cannot solve all the problems, and many of the problems are still, as you say, like if you look at the health of the people around the world, definitely it is a concern, and the consumption of many medicinal, like whether it is pharmaceuticals or any drugs or something, it cannot solve. It is a fact, it is a truth that we cannot solve 100%. There, and every practitioner of medicine knows it, and he prescribes it also, that he doesn't guarantee while he's treating a patient. And he also says that there could be also many side effects arising out of this. And therefore, we are not looking for alternate medicine as such as a honest conversation, but to explore. Do you see that all of this medicinal system will coexist, including the herbal and medicinal, which are herbal and Ayurveda and other traditional? You have also Unani, heard of other kind of system.
Yeah,
And there is
Ayush.
also
Yep.
homeopathy also from Europe, and there are many other forms which are from Africa and Middle East, and they some say and also in Latin America. But these are not a part of the conventional, what you call, formal systems. You can use this terminology where you have the entire end-to-end, entire stakeholders involved in this.
Right.
And I see your point that this rigorous, in a sense, like they are not ready to provide this in a robustic manner, although in principle it is acceptable. But like as you said, Bharat Biotech's vaccine, still it is in hold for approval, or I think it's on the almost,
It's
I think it
approved
is
now.
approved.
It's approved.
It's
Yeah, it's
approved now.
approved now.
So I correct myself.
Yeah.
So you see, even the such a big company who is into vaccines and traditional medicine, they have to take care of approvals and all. Do you think all these regulations and rules, and also and the kind of infrastructure and the systems which are required for so many clearances, patents, do you think it's going to be a stumbling block for all these alternate medicines, and will it be a issue concern?
I don't think there is any other way before we get mass adoption of these medicine, and I would really not like it to be called a stumbling block. The way I look at it is, whether a particular medicine, I am happy to give it to my family members or not, and if I don't know, its side effects, if I don't know its impact, how comfortable I am to give a particular medicine to my beat from any of these science branches, right? I mean, there is a, yeah, so I can't imagine of any shortcuts over here. So sooner we are able to produce the kind of data which is really required to prove and be very confident that these medicines are actually going to work, faster will be the adoption for any of these new sciences. I mean, conventional medicine also, though there are enough challenges, but I mean, as we talked, and the examples that we are referring to, it has its own process and cycle. Though it's a different thing for me to imagine if millions of people have been vaccinated and still no major side effects, then what may be the question mark of for not approving a thing like that. But yeah, I mean, that's where the whole thing is about, capturing data of health related data, which has been a big challenge so far. In developed countries now, I would say that the problem of digitization of healthcare has been solved to a good extent, but still care coordination remains a big challenge. In India, we are still looking at ways of digitization of healthcare, and that's where the new government policies of NDHM and NDH, I mean, like all of that is going to change that of the healthcare as we know quite a bit. I think for everyone, not only for modern medicine, but for, so yeah, so really looking forward to that. And that is where, basically, I mean, I really believe that our health system needs support from the healthcare. I mean, from technology has impacted so much in pretty much every other aspect of our life. but it has not been impacted so much within healthcare. And I think now the time is ripe where basically the technology should support healthcare and should support doctors and nurses, and make their life a lot more easier and simpler, without compromising on any of the patients, and actually provide better care to them. So yeah.
Great. I think your model looks like is actually meeting. And are you geared up for also for taking up services outside the country as well?
Yeah, actually during COVID times, we did offer our solution to a few countries outside India as well. We are in discussion with a couple of countries in South Asia as we speak. And yeah, so we really believe that the solution that we have come up with, many others should be able to use it, because it really saves lives. So yeah, so we are very open to the partnerships. We are very open to the people giving their feedback and support. So yeah.
All right. You talked about NDHM. I was about to come to that. Could you just give a little details about, for the benefit of all the people, what is NDHM and how it has the importance for healthcare, including your company, what is doing with it?
Right. Yeah, so great example, a good example is today, you can use a credit card from pretty much any bank, in small and big places, from the north most from Kashmir all the way till south. And but when if you're expecting, so that works beautifully, but if you have a problem, let's say in north or in east, and someone wants to really know that whether you're diabetic or not, there is no easier way to find that out, right? So, or let's say even if you need a blood, like what is your blood group, it's very, very difficult to actually go ahead and find out, right? So NDHM, among many other challenges that it solves, it ensures that every interaction, that is every time you have visited any of the healthcare provider, for example a clinic or a hospital or a pharmacy or a lab, right, that information will be captured, has to be captured in a digital form locally. And and once the user or the patient approves that it can be shared with others, then it should be able to share with others. So the advantage of that is, as it is called, right from womb to tomb, from the morning, what vaccination we have taken, for example, it's become very easy for people to travel around and just showing their certificates, right, that I have been vaccinated twice, and so it has become very easy. But at the same time, if someone wants to see the prescription and it is lost for whatever reason, it's just unimaginable how to get that prescription again, right? So these things will be completely addressed by something like NDHM. There is a lot of rigor that has gone into it. We are one of the partners who is integrating our solution with NDHM. Very proud to see our, the work that has gone into it, and the impact that it can potentially have on the entire health industry. So yeah, so I think just like in many other industries, the users or the customers was the king. In healthcare, so far it was not that we were completely on the mercy of others. This is going to allow and bring customers or users or the patients again at the center of the entire care. And I'm really looking forward to that day when the information will be as transparent to me as to, let's say, any other nurse or doctor, right? And so that I know exactly what's happening with me. I mean, which is which is like not as much as it should at this point of time. And there is enough cycle, there is enough data about it, like it's all what we have now is transactional health, in the sense, if I have a problem like my bone, if I get into accident and my bone is broken, then I mean the entire healthcare segment today is geared towards just fix that bone and that's it. What happens after that, I mean, no one knows except the patient, and patient has no data even know about it, right? And in normal times it's all great, which is like I would say most of the times, but now more and more diseases are becoming long term, right? Like, and just to see the numbers, the biggest death even in wave 2, the largest number of death because of COVID was around 5,000 plus, but the number of people dying out of heart related ailments every day even today is more than 8,000. And so yeah, so I think the numbers are very stark. The only big, I mean, the difference is here the deaths will happen in next 14 days and or 10 days, which is a lot more shocking. But with as simple disease like hypertension or diabetes, it may take 14 years, so people are kind of used to it and they don't provide immediate response and reaction to it. And that's where the entire healthcare, I mean, like everyone in the healthcare has to kind of play their role to make sure that we care not only about today, but also make sure that we could reduce or minimize the impact of today in 14 into something what may happen 10 years or 14 years later. Yeah, again, it comes back to our original discussion of preventive health. And yeah, so I think the problem is worldwide. It's not only in India, but India has a great opportunity to learn from what has not worked in the developed countries, and which is called to move from transactional health to value-based health, right? And with the kind of direction that we are taking, the focus on digitization, focus on NDHM, focus on I think we are definitely in the right direction. Now, how fast it can be done is the only question which we need to see and care about. Yeah. I mean, like even our organization, the complete, there are two parts to everything. Like one is to digitize every bit of data about the user or the patient. But the way I put it, digitize, so what? Right? The purpose of digitization is not digitization. The purpose of digitization is that, what you can do with it. I mean, like, it allows us, for example, to provide better care, allows us to, if we know that, someone user has to meet doctor again after 2 months, then we know, and that a pop-up comes back both for the patient and for us 2 months later, that hey, this person should actually go ahead and visit a doctor, so that we can create that required nudge for the patient. So care coordination, proactiveness is our core to everything that we do. And of course, that's a tough sell. I can tell you that, because this is something very new. Many people have not, some people like it, that, oh, there is someone who really cares about me more than I care about myself many a times. But some people are like, hey, what is this? Right. But yeah, I think the impact that we have seen definitely gives us a lot of motivation about the work that we do. And we're really excited about what future has to offer.
You might have seen there are the most of the psyche of the people who are in the healthcare system as such, like who would like to get diagnosed. I think they would never don't appreciate going to the for consulting a doctor, or that they would diagnose with certain medicine or a disease. I think this is something a taboo, and also cliche some extent, where people don't even if they think are ill, they know somewhere that they are ill, but they still would like to imagine that, no, I'm not the one so is got affected. And you see that, they somehow want to get rid of this tag on that, I may get diagnosed with certain disease, which will, obviously it's a kind of, people don't want to get diagnosed with certain disease. So they would like to prevent that also among social systems and within a family, that people will get, to know about this, and also in the in the society. So people never appreciate it. It's not like, you're getting award or something. So people don't appreciate, even the same thing happened during the pandemic. They were want to share their that they would get positive, or they tested positive. People were afraid that, they will be tested positive if they get checked for tests. So do you think virtual, I mean, I'm not using the word digital healthcare, I'm going to say virtual healthcare in the form of digitization. Do you think has actually brought people closer to the medicinal systems? Has it bridged the gap? And how do you see that, it has benefited people? Can you talk about some examples? And also, we have recently heard of, cases in some film star, somebody who had no disease at all, and suddenly we saw that, they suddenly passed away. And do you think these kind of gaps also can be fulfilled using this, your platforms? You also please talk about your platform and app, how you're connecting with the doctors and people.
Right. So yeah, so I think I mean, like I said, the purpose of digitization is not digitization of health. Okay, the purpose is digitization is that it becomes easier for a lot of analysis, a lot of so that the better care can be provided both to the I mean, better care can be provided to the patients. A better it becomes easier and easier for the doctors to do the right diagnosis because the information is provided in a structured manner, right? And 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 the whole history, right? I mean, like, if you have the history, then anyone can do a better analysis of what has happened with the patient.
Exactly.
And just seeing one snapshot of the information. So yeah, so I mean, these are the advantages of digitization, and that's why it is being used. But having said that, a lot more awareness has to be created. Like you mentioned about taboo, right? I mean, like, of anything, the best example is vaccine hesitance, right, for COVID, right? Or polio. I mean, we have seen it all, right? So we really need to go ahead and talk more about it. It has to be in schools, that every student should go and get their their parents checked annually. They need to be monitored periodically, and the guidelines for many of those are already available. But everyone is so busy that no one remembers, and no one actually does it. And that's why I really believe that the power of digital health is to make things easier and simpler for others. But the very important role is of health coaches. We call it ashas, we call it NMs, we call it various names we have given. But the human touch is very, 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 very important. Okay, so, and anyone who is able to combine these two effectively, and we have seen the impact, right? And basically, we really believe that the future real care can be provided by a combination of technology along with the human touch, which can be through the health coaches. Because see, the doctors will always be in short supply, and there can never ever be enough number of doctors. So I mean, most of the work that we are doing right now is to actually support the doctors in providing better care, timely care, and so on. So our entire platform is based on two major principles. One is the digitization of all kind of health data. be it labs, be it prescription, be it any kind of inform data that is captured. And the second is that, what do we do with each of these information? What do we do next? Right? For example, we have come up with various screening forms for various diseases, right? And again, they are based on AI algorithms for which the papers and all has been published, right? And then we are based on that, we are suggesting whether someone even bothers to go for any additional test or to go to the doctor or not. Right? If they don't, then it's great. You should just continue to, live your life. But if not, you should provide care. But we have also seen that only 11% of the people bother are self-motivated to actually go ahead and follow up the entire cycle, right? But once provide with the right nudge, be it the notification, be it the calls from a health coach, that number 11% actually can be pushed to 70-75%, right? For a follow-up consultation, follow-up labs, or whatever it may be. And and that makes all the impact between whether something, look, some people always say, oh, we did some extra tests because just for the heck of it. But but the real impact is we are very absolutely confident, which was doubtful, that someone is, let's say, diabetic or not, or someone is hypertensive or not. We have become absolutely confident that there is nothing wrong in it. So it's just like for COVID, we came up with a good guidelines or care pathways for various kind of diseases and various levels of COVID. We do have some for many other diseases, but I think the implementation of that is not at all rigorous at this point of time. And that's something which has to be done more rigorously, more effectively, and more efficiently. And we will see the impact of that in the society. So yeah, sooner we accept the importance of preventive health in true sense, sooner we start listening to our doctors and nurses, even though we don't see or feel anything on our body. I think better will be, the chances of taking a risk, like the, scenario or situation that you mentioned about people just passing away, without any, giving any chance. So I think we can avoid quite a few of that. For others, we have to just keep learning and understanding, and we can't do that unless we have enough information or data. So it's a medicine is going to be a combination of a lot of this analysis, and that's where we are seeing many more data scientists and all getting into healthcare. So really looking forward to that change, that proud to be excited to be a part of that change which the healthcare is going through right now.
Great, Manish. I think you're doing really great work, and your company, and of course technology is a great enabler. But I think the kind of work which is going on brings a lot of optimism, especially countries which have not fully set up the modern infrastructure, quote unquote, in the medicine. Right. It is called the modern. What is conventional is always modern, but I think the innovative times are here.
Right.
So a lot of disruptions are happening, and changes like this, whether it's pandemic or whatever the diseases which are coming in. I think technology has become a great enabler, and also and then the models like which you are working, and I'm sure some of the other companies also. I think it gives a lot of scope for masses to bring value-based healthcare. And people can get benefit out of this. And I see that there is a lot of social and behavioral aspects also. You're bridging gap, like building confidence through data, information, and bridging the gap between doctor and and the patients, and you're bringing them to their doorstep. So it's a great work you're doing. I'm sure there's good news for also people who are in the healthcare to have a lot of opportunities. How do you think this is going to be? I know healthcare has been seen as like more of a curse in the, that people, it's a blessing in disguise kind of a thing. People who are professionals in the health, they always, people curse that, they're making a lot of money out of sick people. So I think you're doing a great work where you're making people feel good about what their services you're availing from you. And you see that the time has come that a lot of quality and value based services can be availed, and then a lot of startups or companies can look at these models more. Professionals and students can walk into healthcare as a field future career.
Yeah, absolutely. See, I think it's becoming more and more obvious that anything that is just repeated day after day, machines are going to take over that, right? So, I mean, the only thing which keeps human like us apart is that we keep learning every day, right? And I think that way healthcare is going through a massive transformation at this point of time. So, very exciting times for all the students and people to get into healthcare. It's definitely, any change is tough. But that's what makes us. I mean, the entire situation or entire experience is so much more rewarding, right? So I really believe that it's a great industry to be in at this point of time. Observe things very closely, what's happening, why it's happening, and put your original ideas to this, right? I mean, like, the best part about, we won Hult Prize when we were students, and the whole idea of Hult Prize is that how can I bring original ideas to the masses to solve the problems which has not been solved before. So I really think that this is a great opportunity to be into healthcare. Every country has its own nuances, of healthcare. So it makes it very challenging, but at the same time very, very interesting and rewarding. And one of the great thing about healthcare is you can actually see the health of people improving. Right. Why? When I personally see someone who had no clue about they were hypertensive or diabetic or had, thyroid problems, and such, crazy numbers or values, and suddenly over a period of time when we see their health, the values improving, it's like very, very rewarding that so yeah, that on the bad days, which every entrepreneur goes through, and when I get to see some of this information about the users and our patients, I mean, it gives so much more energy to keep pushing ourselves and the team ahead in making differences into people's life. So yeah, I mean, I think it's a great time to be in healthcare and a great industry to be in. Not only, and so I tell my team all the time that, it's whatever we are doing, it's for you, and it's also to learn for your family, what you can do for your family, right? I mean, we have, instructions that, everyone whom we care about is as good as our family, right? Because it can happen to our parents, and yeah, so the kind of care that we provide is as good as that, right? So yeah, so I think I mean, there is it's amazing to be in healthcare at this point of time, and there's so many problems, there's so many challenges, and yes, and that's where we should go ahead and solve them. So yeah.
Yes, that's the best part about handling challenges, that there's a great deal of satisfaction in solving them. So it's a very optimistic note what you have given, and on that optimistic note, I would like to end, because you should end always on the optimistic note. And I will give a final word to you, that what would you like to appeal to the doctors and also various stakeholders, how you would like to involve them? You can give them remarks, inviting them to get associated with you so that they can benefit. I have heard of some of my acquaintances also that they were the beneficiary from your platform and your services. So I congratulate you. And therefore, I hope more and more people come to know about your innovation and model which you have in place in healthcare. So you can I'll give a final word. what would you like to appeal to all the stakeholders like doctors and people who are beneficiaries in healthcare and other administrator, whatever you can say?
Yeah, I mean, I think a special thanks to all the doctors, for doing what they're doing. I mean, they are considered to be second god. COVID just reminded us why they are considered to be the second god, right? But yeah, so I think while there's a lot of change that is happening, and I know that which is making them uncomfortable, I think the bottom line is that we are here just to support, them, and pretty much every
So that's where you
stakeholder.
come in, if I may interrupt. I think
Yeah,
that's where the whole idea that you have this platform, you can be a win-win situation for everybody. Not
yeah,
only doctors, all kinds of doctors. I am not an expert in healthcare, but I could see
yeah,
your platform and I have heard of it. So what
right.
you're explaining, I understand that everybody can be part of this, whether it's conventional medicine, modern medicine, doctors, allopathy, homeopathy, or Ayurvedic. And
Right.
I think so that's where so you can go ahead.
Yeah, no, so absolutely. So, well, where we believe we are a little different is that most of the platforms that we have seen and has been used as not very comfortable and convenient to use, and that's where the change becomes so much more difficult. We have ourselves. Changed our platform multiple times, and I say the 4 times we broke our platform and then remade it again, made it again, and but yeah, I think we feel very comfortable with where we are. Our doctors feel who use the platform feel very, very comfortable for where we are. But I really want to say that that's just the beginning of the work that we're doing. I mean, with the information that we have and what we're learning, we are going to make the whole situation of like the whole interaction between the doctors a lot more simpler. Like for example, in a typical, if I say that doctor's interaction with the patient is 15 minutes, then often in US we are hearing that 13 minutes they are looking at the computer and maybe only 2 minutes with the patient. But what we are able to do is to automate a lot of these pieces, make the use of the latest technologies to make sure that the just writing a prescription becomes very, very convenient. It came very, very handy during pandemic, where the doctors had to handle actually a lot of patients, but the care line pathways are very few, and depending on the levels, they could actually very quickly define that what are the kind of medication they had to give. So we had built in a lot of features which makes their life very, very simple. And just the e-prescription where they write kind of adapts itself to the way of writing and the kind of prescription that they put. It's a lot of artificial intelligence has gone into building that predictive solution. So yeah, but the bottom line is that we are here to learn. We want to learn every day. We need a lot of feedback. While the platform is great where it is, but we will continue to keep learning and making it better and better. And we are here to support the entire healthcare community in becoming to be able to provide a better care than what is being provided right now, be it easier, simpler, faster, convenient, all of it. So yeah, so I think I mean that's where we come in, and that's where we need a lot of people to work with us together who can help us in doing that. So yeah, so continue to be a great learner. My team, my only condition for everyone in my team is who works with us is you have to learn every day. And the day you stop learning, I mean, please come and tell me. And if we can't find you better ways to learn, then we'll find your place within our community where you can continue to learn. So yeah, so I think that's our focus, and we continue to do that. Proud to say that we continue to do that effectively every day.
Well, on that note, I would like to congratulate once again, wish you all the best, and may you touch more people. I think you are touching maybe a few, maybe some thousands now, as of now. And I hope, what is the number roughly?
We have moved into many lakhs now, so and that
Oh, great.
number, yeah.
Hope in the next few years you will reach few millions, and then later maybe in 10 years from now, maybe you will touch at least maybe 1 billion people. So on that note, thank you.
Thank you, Naveen. Thanks for having and and it was really great pleasure talking to you. All the best.
Thank
you. Bye.
Thank you. All the best. Bye.